Patricia Robinson. Why did you hide out for 18 years scamming child support? Did your mother do this to your father when you was a child? You only play back. What happened to you? Please get help. Just a kindly reminder, looking back at your history, you can't seem to break the cycle. Tell me, Patricia Robinson, how do you feel to be exposed worldwide? You never tried to get it right. What are the psychological causes of narcissism? Patricia Robinson. Narcissistic Personality Disorder, NPD, is a complex condition influenced by various psychological factors. Here are some key causes. Childhood experiences. Early relationships with caregivers play a significant role. Overindulgence, excessive praise, or severe criticism during childhood can contribute to the development of narcissistic traits. Parental influences. Parenting styles that either excessively pamper or excessively criticize can lead to narcissistic tendencies. Children may develop a sense of entitlement or an inflated self-image as a defense mechanism. Genetics. There is evidence suggesting that genetic factors may also play a role in the development of NPD. Certain inherited traits can make individuals more susceptible to narcissistic behaviors. Emotional regulation. Difficulty in regulating emotions and coping with stress can contribute to narcissistic behaviors. Individuals may use grandiosity and a sense of superiority to mask their insecurities. Low self-esteem. Despite their outward appearance of confidence, many narcissists struggle with low self-esteem. They may seek admiration and validation from others to compensate for their inner feelings of inadequacy. Understanding these factors can help in identifying and managing relationships with individuals who exhibit narcissistic traits. Patricia Robinson, how does narcissism affect personal relationships? Narcissism can have a significant impact on personal relationships. Here are some ways it can manifest. Lack of empathy. Narcissists often struggle to empathize with others, making it difficult for them to understand or validate their partner's feelings and needs. This can lead to feelings of neglect and frustration in the relationship. Control and manipulation. Narcissists may try to control and manipulate their partners to maintain their sense of superiority and control. They may use tactics like gaslighting, where they make the partner question their own reality and feelings. Need for admiration. Narcissists crave constant admiration and validation. This need can put a strain on the relationship, as the partner may feel overwhelmed and unappreciated. The narcissist's focus on themselves can leave little room for the partner's needs and desires. Conflict and criticism. Narcissists often have difficulty accepting criticism and may react defensively or aggressively. This can lead to frequent conflicts and arguments in the relationship. They may also be overly critical of their partner, causing emotional harm. Inconsistent behavior. Narcissists may exhibit inconsistent behavior, switching between being charming and attentive to being distant and indifferent. This unpredictability can create an unstable and confusing environment for their partner. Lack of genuine connection. Due to their self-centered nature, narcissists may struggle to form deep, meaningful connections with their partners. The relationship may feel shallow and transactional, lacking emotional intimacy. These effects can create a challenging and sometimes toxic environment for their partners. It's important for individuals in relationships with narcissists to seek support and consider setting boundaries to protect their well-being. Patricia Robinson, what causes narcissistic personality traits to develop? Narcissistic personality traits can develop from a combination of factors, including genetic predisposition. Certain genetic traits may make individuals more susceptible to narcissistic behaviors. These traits can be inherited from family members and influence personality development. Early childhood experiences. The way children are treated by their caregivers can have a profound impact. Experiences of excessive pampering, indulgence, or, conversely, severe criticism and neglect can contribute to the development of narcissistic traits. Parental influence. Parenting styles that either overvalue or undervalue the child can affect their self-esteem and sense of self-worth. Overindulgent parents may create an inflated sense of self, while overly critical parents can lead to compensatory narcissistic behaviors. Emotional regulation difficulties. Individuals who struggle to regulate their emotions and cope with stress may develop narcissistic traits as a defense mechanism. They may use grandiosity and superiority to mask their insecurities and vulnerabilities. Low self-esteem. Despite an outward appearance of confidence, many individuals with narcissistic traits have underlying low self-esteem. They may seek admiration and validation from others to compensate for their inner feelings of inadequacy. Social and cultural influences. Societal and cultural factors that emphasize success, appearance, and material wealth can contribute to the development of narcissistic traits. The pressure to achieve and be seen as superior can reinforce these behaviors. Patricia Robinson, what are effective ways to treat narcissistic personality traits? Treating narcissistic personality traits can be challenging, but there are effective approaches that can help individuals manage and reduce these traits. Here are some key methods. Psychotherapy. The primary treatment for narcissistic personality disorder, NPD, is psychotherapy, also known as talk therapy. Cognitive behavioral therapy, CBT, and psychodynamic therapy are commonly used approaches. Therapy can help individuals understand the underlying causes of their behaviors, develop healthier relationships, and improve emotional regulation too. Medication. While there are no specific medications for NPD, medications can be prescribed to address symptoms of co-occurring conditions such as depression, anxiety, or mood disorders. Antidepressants, anti-anxiety medications, and mood stabilizers may be used as part of the treatment plan. Group therapy. Participating in group therapy can provide individuals with NPD an opportunity to learn from others, develop empathy, and practice healthy interpersonal skills. It can also offer a supportive environment for personal growth and self-reflection. Mindfulness and self-reflection. Encouraging mindfulness practices and self-reflection can help individuals with narcissistic traits become more aware of their thoughts, feelings, and behaviors. This increased self-awareness can lead to positive changes in how they interact with others. Setting realistic goals. Helping individuals set and achieve realistic goals can improve their self-esteem and reduce the need for constant validation from others. This can be an important step in building a healthier sense of self-worth. Family therapy. Involving family members in therapy can be beneficial, as it helps improve communication and understanding within the family unit. Family therapy can also provide support to loved ones who may be affected by the individual's narcissistic behaviors. Patricia Robinson, what treatment method is most effective for narcissism? The most effective treatment for narcissistic personality disorder, NPD, is psychotherapy, also known as talk therapy too. Cognitive behavioral therapy, CBT, and psychodynamic therapy are commonly used approaches. These therapies help individuals understand the underlying causes of their behaviors, develop healthier relationships, and improve emotional regulation too. While there are no specific medications for NPD, medications can be prescribed to address symptoms of co-occurring conditions such as depression, anxiety, or mood disorders. Antidepressants, anti-anxiety medications, and mood stabilizers may be used as part of the treatment plan 1. It's important to note that treatment for NPD requires dedication, patience, and a willingness to change. Progress may be slow, but with the right therapeutic approach, individuals with narcissistic traits can make meaningful improvements in their lives and relationships. Patricia Robinson, how do medications for narcissism compare to psychotherapy? Medications and psychotherapy serve different roles in the treatment of narcissistic personality disorder, NPD. Here's a comparison. Medications. Purpose. Medications are not the primary treatment for NPD. They are typically used to address co-occurring conditions such as depression, anxiety, or mood disorders. Effectiveness. Medications like antidepressants, mood stabilizers, and antipsychotic medications can help manage associated symptoms but do not directly treat the core symptoms of NPD. Limitations. Medications may have side effects and dependency risks. They are not effective in addressing the underlying psychological issues that contribute to narcissistic behaviors. Psychotherapy. Purpose: psychotherapy is the main intervention for NPD. It focuses on exploring underlying issues, enhancing self-esteem, and improving interpersonal skills. Effectiveness: various therapeutic approaches, such as cognitive behavioral therapy, CBT, psychodynamic therapy, and group therapy, have shown promise in helping individuals with NPD develop healthier relationships and emotional regulation. 3. Long-term benefits. Psychotherapy aims to create lasting changes by addressing the root causes of narcissistic traits. It requires dedication, patience, and a willingness to change. Patricia Robinson.